Caring for your hair transplant after the surgery. At the clinic, we will do our best to give you the best possible results. But everything is not in our hands, and you need to play an active role in your recovery. We talked about what you can do to put your body in a healing mode and to speed up the healing and speed up the results and maximize your results. But what precautions do you need to take after the surgery in terms of cleaning and washing and other aspects related directly to the surgery? Let's talk about that. The day after the surgery and minimum 12 hours after the surgery, you can take a shower. But you have to be extra cautious. We don't want to dislodge the grafts. Stand under the shower, a low pressure shower. Let the water hit on your forehead or in your donor area in the back and run back, forward or backward through the recipient area. I want you to take an indirect low pressure shower. Rinse it well, stand under the shower like this for 4 or 5 minutes so that the recipient area is well rinsed through. You can then take any shampoo that you like, lather it in your hands and dab it onto the recipient area. And you can also put it on your donor area and slightly, softly, gently, not rub, but apply it onto your donor area. But on the recipient area, you only need to dab it onto the recipient area. Let it stay there for 2 minutes and then rinse it off with a low pressure indirect shower. You can then use a new towel to dry your donor area, but do not use any towel on your recipient area for the first 12 days. You can then repeat this process 2 to 3 to 4 times the first day after the surgery. And you can also apply the shampoo not once, but even 2 times in each shower. The second day after the surgery, you only need to wash your head the same way once a day. A low pressure indirect shower, dab on the shampoo to the recipient area, no rubbing. At 12 days, I strongly encourage you to take showers as if you had no transplant. That is quite important. Some patients may want to be extra cautious, extra gentle to the grafts, but you shouldn't really. It can cause the build-up of dirt, scabs, and it can take longer for your recipient area to fully clear. So, at day 12, I want you to take a completely normal shower. You don't want to be extra rigorous, but you also do not want to be gentle. You want to pretend you didn't have a transplant at all. So normal showers after 12 days. The first 2 nights following the surgery, I want you to sleep with an elevated head end. You can use one big pillow or you can use 2 smaller pillows so that your head is a bit elevated. We are more likely to ask you to sleep on the back for the first 2 nights. But depending on where the grafts are implanted, we may actually recommend another position for you to sleep in. We'll give you instructions about that at the time of the surgery. Medicines. If we prescribe you any medicines, you need to take those. That could be antibiotics. It could be other medicines considering your specific circumstances. But we will guide you on what we want you to take and how long we want you to take it for. You don't have to take any painkillers, and many patients do not need painkillers after the surgery. We may recommend you or suggest you can take steroids after the surgery to minimize the risk of swelling. But that is also not compulsory. As I said earlier, swelling can happen, but it's not dangerous. And it goes away usually by 2, 3, 4 days by itself. So we may give you steroids, but they're not compulsory to take. What not to do after the transplant? Again, do not smoke. Minimize the use of processed foods, simple sugars, refined sugars, saturated fats, caffeine. You want to have the body in a healing mode. You don't want the body to be maximum inflamed. You want it to be ready to heal and grow the grafts. No hard exercise for the first 2 weeks. After 4 days, you can resume mild exercise, like 30 to maximum 50% of your normal capacity. Nothing more than that. After 2 weeks, you can resume whatever exercise you like. For the first 2 months, you should protect the operated area, the recipient area, and the donor area from UV lights. You can be out in the sun, but you need to cover the recipient and the donor area. That could be with a hat, a bandana, or something else. But you would want to reduce UV light exposure, as that might cause hyperpigmentation. Whenever you have trauma to the skin and you expose it to UV lights, it can cause you to develop hyperpigmentation. So to avoid that, do avoid sunlight for the first 2 months. Some people may be very sensitive to sunlight, and they may even need to extend that period to 4 months. The more fair your skin is, the more likely you need to be cautious about sunlight exposure. If you go out in the sun after 2 months and you experience increased redness in the recipient area especially, well, then you need to extend that period where you do not expose to UV light or sunlight. If you still have any questions about your hair transplant, how to care for it after the surgery, then do speak to us and we'll guide you further on how to take care of your hair transplant, how you can be in a healing mode, and what specifically we need to take into account in your specific case. Thank you for watching, and let's stay in touch.